place. So I'm Noelle Pina. I'm the Chief of Staff at the Cape Cod Chamber of Commerce. And I just wanted to let everybody know, in case you didn't hear it when you joined us, that this meeting is being recorded. And it's so that we can be able to share this very important content with the members of the chamber and with the community at large. We know that schedules are tight and people get really busy. So I just wanted to start by letting everybody know how this came to be. So Ashley and I both volunteer on a group with the the Massachusetts Business Coalition for Early Childhood Education. And Ashley's been informing that group over time for several years now about childcare policy in Massachusetts, and really helping to paint a really good picture for us of how policy impacts the business. And she's put together a great report that came out this summer about what the current status is of that. And so when I read the report, I thought right away it'd be great to have Ashley present this to members of the chamber. So she's here today to do that, and just to set the framework for everyone. So this will be the start of a series where we're going to have this presentation first, and then we'll have some follow-up dates that you will be notified of, with where we'll take deep dives on certain benefit areas. So I'm thinking we'll probably start with the cafeteria plans and then move on from there. So that's all that I have to say. And just thank you, Ashley, so much. I really appreciate you doing this.
Of course. Happy to kick it off. Yeah.
Go right ahead.
Awesome. Well, good morning, everyone. Very nice to meet and see some of you. As Noelle said, my name's Ashley White. I'm a senior policy researcher at the Massachusetts Taxpayers Foundation. We are a nonprofit, nonpartisan public policy research organization. We've been around for a pretty long time. I'd say our reputation is in kind of public finance and the state budget, but we also have expertise in healthcare policy, in education, which is kind of part of the reason I'm here today. So as part of my role, I focus on early education and care research. And so this past spring, I wrote a paper about employer-supported childcare, kind of what the context is in Massachusetts for employer-supported childcare, what those benefits tend to look like, what are some considerations for employers as they potentially think about implementing some of those benefits, and then what are other states doing to potentially incentivize employers to provide employer-supported childcare benefits. So this morning I'm going to be going through a presentation that hopefully does a good job of kind of outlining some of that research. Please feel free to jump in if you have questions at any time, or put them in the chat. It also might be helpful for me if folks could just put in the chat kind of the business that they represent, or their kind of role. That would just be helpful, so that I can kind of cater my comments to that. So without further ado, I'll share my screen. Noelle, can folks see that? Good?
Yes.
Okay, perfect. So in terms of the agenda for this morning, hoping to keep this, relatively brief, hopefully informative for you all. But again, please feel free to chime in with any questions that you might have. Want to just start with kind of the Massachusetts context. Why did MTF decide to kind of take up this research? What's happening in Massachusetts, which some of you might be aware of, but just good to kind of table set, at least initially. Second, want to just talk about the different employer options that there are to provide childcare benefits, provide an overview as to what some of those common ones are, and then we're going to talk a little bit about kind of considerations for each of those. We're going to talk a little bit about what the feds do, because there is a program to try to incentivize employer-supported care, but we'll talk about that program a bit. And then we're going to look to other states and talk about 3 different models that I came across to try to incentivize employers to provide childcare benefits, and kind of what are the pros and cons of those different models. So hopefully you all can kind of walk away with a good sense of kind of what's out there, what are other states doing, and potentially some tips on how to engage with your legislature or other kind of business groups who are also kind of organizing around these issues. So the Massachusetts context, again, some of you are probably well aware of this, but there has been, at least recently, more recently from the pandemic, strong support on Beacon Hill to expand childcare access. And incentivizing employer-supported care is one option that has really come up in conversation about how to kind of aid in those efforts. During the sort of depths of the pandemic, there was this Early Education Economic Review Commission. It was a legislative kind of commission that was established that really took a kind of wide lens at the childcare system, identified some challenges and gaps, and made recommendations for how we could improve the childcare system in Massachusetts. That commission published 14 different recommendations, and one of those recommendations was around exploring some best practices to further promote employer-supported childcare benefits for employees. More recently, I think further steps have been taking to kind of try to push this agenda along, and that the Senate passed an early education reform bill last legislative session. It did not pass the House, and so it sort of died after the Senate. But that bill included this recommendation from the commission. And then this session, we saw kind of a revival a little bit. There was a bill introduced by Representative Peisch that was solely around, it's a pretty small bill, you can go check it out, solely around encouraging employer-supported care. And if folks want to learn a little bit more about that bill and what it's trying to do, I'm sure Noelle knows a little bit about it, but also Tom Weber, who's a part of that business coalition that Noelle mentioned, has also played a big role in it, so folks can kind of reach out and connect with him as well. So again, like I said, want to go through some pretty common options that employers can implement at their businesses around childcare benefits. I think the overall message here is that there's a range of solutions that employers can provide, right? It really depends on kind of what works for your business, what works for your employees. There's really no kind of one size fits all or kind of silver bullet, right? It really depends on who your workers are and how feasible implementing these benefits might be. I would say too, I think the research kind of uncovered that these options are really most prolific among larger businesses because they tend to have greater capital, they tend to have more resources, they have HR departments, they have tax people, right, who can kind of dedicate time to figuring out all the complexities of potentially implementing a childcare benefit. But there are some, I think, options that are potentially more feasible for smaller businesses as well that folks should consider. So on-site childcare would be one that's obviously probably better for larger businesses, right? This is childcare at the employer's office. We see subsidies with a local provider. So that's an employer saying, I'm going to subsidize the cost of my employees' childcare at an existing, childcare provider. Siemens Bank is a really great example of this as well. They subsidize a portion of their employees' childcare costs, and they have a partnership with a local provider, though they do say that their employees can kind of go wherever they would like to find that childcare. So if folks are interested in learning about that, I'm sure Siemens would be happy to chat with folks. Backup childcare is another seemingly easier one, I would say, for smaller businesses. It's at-home care or center-based childcare if regular childcare coverage kind of falls through. So if the childcare center closes or if there's a holiday and they're not open or whatever it is, parents shouldn't have to sort of not go to work or not be able to work because of that. And so backup care comes into play there. Then you've got flexible spending accounts, which these operate very much like a health savings account. So you, as an employee, you can put kind of a pot of money into this account, and then you can kind of use it for childcare expenses throughout the year. There are some considerations which we'll get to about kind of the pros and cons around that one. That's basically the premise there. And then lastly, resource and referral services. I think these are obviously, services to help families find and get connected to care. There is really a kind of a broad kind of scope of what that could include. So in some cases, it could be sort of a light touch service, and in other cases, the employer could actually have someone who's kind of calling families and looking up childcare and kind of talking through with families about what their needs are and where the availability is. So it really all depends. There's sort of a lot of flexibility in terms of what that benefit could potentially look like. So hopefully that gives you kind of a good idea of the kind of potential options or the most common options out there. I think there are considerations for each of these, and like I said earlier, there's no one size fits all. Businesses have to really figure out what's the best option for them and the best option for their employees. On-site childcare does show data does show that it is effective, right? It's effective at increasing retention. It's effective at reducing turnover. But I think it is a really costly option. It requires a pretty large physical footprint, and it certainly requires an understanding of the childcare business model to set that business up. A lot of companies use sort of a third party to kind of manage that as well. Subsidies with a local provider, again, easier, perhaps less costly option than on-site childcare, but you have to consider, that you've got to have administrative resources to kind of manage relationships with providers, but also kind of do the administration of the program through payments and payroll deductions and that kind of thing. I think backup care is sort of most critical for lower wage hourly workers, right? These are workers who disproportionately tend to be workers of color. And the reason that I think that's so critical is when an hourly wage worker misses out on work because of a childcare issue, they lose out on wages, right? It's a little different than a sort of a salaried employee. Obviously, I think there are a lot of studies out there about salaried employees, particularly women, who they might miss work, and that disrupts their kind of career trajectory, and that's something to obviously consider. But they're not missing out on wages when they miss work, and so having this backup care, I think, is really, really critical for hourly wage employees. But it really only works if it's accessible and affordable, right? So the backup care option, if it's out of the price point of the families, it's not going to be helpful. If you refer them to a backup care service that doesn't actually have seats, obviously that's not going to be helpful, right? So it's crucial to kind of have the right system in place for that to be super effective. The flexible spending account, again, low cost option, does require that HR and tax expertise. There is a really low contribution amount. So the maximum that you could put in that is like $5,000 a year. And as I think folks may know on this call, childcare costs in Massachusetts are some of the highest in the nation. It's about $21,000 a year for private infant care. And so $5,000 is not too much of a dent in that. And so I think some work at the federal level there, but employers can also kind of contribute to the flexible spending account as well as the employee to kind of make those dollars go a little bit farther. Resource and referral options, again, pretty easy, more affordable option. Obviously, finding childcare is a challenge, but some of the greatest kind of needs in the system are around supply and the cost of care. And so that's just something to consider, in terms of maybe pairing resource and referral services with another benefit that gets at some of those supply or some of those cost issues. I wanted to just take a minute here to kind of spotlight some employers in Massachusetts. And really the point here is to kind of share with you all some organizations that are kind of moving forward and trying to provide some of these benefits to their employees. Perhaps you can connect with folks at these organizations, or perhaps you can kind of just get a good sense of what's happening out there in Massachusetts. So Boston Children's Hospital is a big example of on-site childcare. A lot of hospitals and like higher education institutions tend to have on-site childcare. Makes sense when you think about a hospital. People are working kind of around the clock, and in-person work is necessary in many cases, right? And so having that on-site is helpful. Stevens Bank, as I mentioned, a great example of an organization that's using resources to subsidize the cost of its tuition for its employees, with the remaining cost being deducted from that employee's paycheck. Again, flexibility in terms of where they want to go, but they do have a formal partnership with a particular a provider on the Cape. And that's helpful to the provider, I think also helpful to the employer, but certainly helpful to the provider too, because they know that there's sort of a steady stream of people coming to their center. Lastly is backup care. Basic Health has a partnership with Square One Early Education and Care, and they provide backup care to their employees. The employees do pay the private pay rate. Obviously, there are options for employers to potentially subsidize the cost of backup care. That could be something that folks consider as well. So just briefly going to talk about the federal program to promote employer-supported care. I think just helpful for folks to know that this is out there. I think one of the big reasons I talk about this in the paper is honestly to say that it hasn't necessarily been effective. And so when we look at what has been effective, a lot of it is states and businesses within states kind of taking initiative and putting it upon themselves to kind of institute these benefits. I think this program could use some tweaks to help incentivize employers to do so. But just wanted to kind of give you this context. So it's basically a tax credit, right? But it really kind of is trying to incentivize mainly sort of building or acquiring or renovating a childcare facility. Though there are also some credits here, as you can see, for potentially contracting with a facility to provide childcare, or contracting for resource and referral services. I think the biggest sort of deterrent here, and why there hasn't been good take-up rates, and you can see that in the second bullet there, has to do with the credit amount being pretty low. And so, as I mentioned earlier, acquiring or constructing or building on-site childcare is very expensive, and the maximum credit amount of $150,000 doesn't really do the trick there. But it could be potentially useful for resource and referral services, for instance, given the cost there is likely lower than building childcare. But I think awareness about this credit is relatively low. So hopefully now you know some information about it, and potentially can do more research and potentially look up if this is something that you might be interested in exploring. So because we kind of came up empty in terms of what does the federal government do to try to incentivize childcare benefits at employers, we decided to look at other states and see, are there other people who are doing some interesting work here that maybe Massachusetts could replicate or consider moving forward. And so what came up? It was 3 different models that promote employer-supported care. We've got cost-sharing programs, grant programs, and tax incentives, which are the most kind of traditional or been around for a really long time. Cost-sharing programs is sort of a new model. It's basically a public-private partnership where the cost is split between the state, employers, employees. In some instances, it's a cost-sharing model that's just a partnership between the state and employers. So basically, they're all kind of contributing to the cost of care to make that cost lower for the family, and hopefully that helps retain workers, helps get workers back into the workforce, so on and so forth. Grant programs, these are really designed to, I think, incentivize employers to provide childcare benefits, and they do that by matching or subsidizing sort of a private investment, right? So if I'm an employer and I want to build on-site childcare, I can apply for this grant program, and then they subsidize the cost of doing so. The third is tax incentives. As I mentioned, these have really been around like the longest time in terms of trying to incentivize employer-supported childcare. Many states, I think, have had sort of old tax credits that haven't really worked very well, but some states have made more recent attempts to kind of adjust and amend some of those tax credits to make them more flexible, to kind of tweak them to see if they can kind of further incentivize or further make those tax credits work. So those are the three models, and I'm going to give some examples of states who have done each, basically. So the cost sharing model, this is something happening in Michigan. It's called the Michigan Tri-Share Program. Again, it's splitting the cost of an employee's childcare between the state and the employer and families. Basically how it works is there are kind of regional facilitator hubs. Because this is a big kind of somewhat statewide program, you need to kind of create economies of scale. And so how they did that was to create these facilitator hubs that basically manage the program in their particular geographic area. So they're in charge with, recruiting employers. They're in charge of kind of the administrative process of implementing this program. With this program, you do see, and you see this, I think, with a couple different programs as well, but particularly this one, a real focus on middle-income families, right? And I think that has to do with the fact that, in Massachusetts, for instance, we have a subsidized childcare system, right? We provide financial assistance to low-income families so that they can afford childcare. But we do so at a pretty low level, meaning you have to be quite poor, right, to actually be eligible for these programs. And that there is this whole other kind of class of families, right, who are not eligible for the financial assistance, right, but still cannot afford the cost of care, right? And so these programs are really designed to kind of try to hit that middle income or moderate income family. And so you can see here that they've got some rules around kind of what the eligibility is. and they've got some rules around kind of the children's, but that's essentially how it works. I would say this program is pretty complicated, right? To administer, and I think it's something that the state is thinking about, is aware of, but it is a more complicated program to administer. Though I think from the employer standpoint, hopefully relatively easy to kind of engage with these facilitator hubs within their region. So cost sharing models, again, this is a one in Kentucky, a little bit more streamlined because it's just sharing the contributions between employers and the state. And so it's basically like a state match. So the employer contributes a certain amount of money towards their employees' childcare, and the state matches that at a certain percent, depending on the household income of that employee. And so it's a little bit, like I said, a little bit more streamlined than the Michigan program, but essentially a very similar concept. This one is one that I think potentially has the most legs, to put it simply. It's a childcare business incentive grant. It was started in Iowa. It's essentially a 50-50 cost sharing model, right? So the employer can potentially build or expand childcare facilities, or they can help employers purchase childcare slots for their employees. And so they kind of help match the cost of that. It's a pretty easy program to administer, given it's a pretty easy 50-50 cost sharing model. And they have some stipulations in terms of the size of the business and that kind of thing. As I had mentioned earlier, I think a lot of times some of these programs, it's much easier for a larger business, right, to get involved because they have the resources and the capital to do so. And so what you'll see in some of these programs, particularly in Iowa, is trying to design the program so that they can engage small businesses as well. So for instance, in this model, they're saying businesses have to have at least 75 employees, but smaller businesses can form a consortium and to potentially meet that minimum so that they can get engaged and they can be a part of this kind of cost sharing model. So this is one when I talked about the bill from Representative Peisch that is trying to incentivize employer supported care. It is very much modeled after what's happening in Iowa, if folks are interested in that. And folks might also be asking, you know, how does this pertain to me, or why should I care about this? I think as a business community, I think for these things to be impactful, they need to be kind of at scale, right? And so as the business community comes together, whether it's through the chamber, whether it's through the business coalition that Tom Weber is talking about, having a sense of what the ideas are out there and having a sense of what you all like or don't like, or what works for you as a small business or what works for you as a larger business, I think is important to kind of go into those conversations informed and ready to advocate for what you think is best and how you think you can help your employees most. So that was just a little aside. Tax credits in Colorado and Kansas. Again, I think, again, we've had these tax credits for a long time, right? Data has shown they're really not effective, right? They haven't been historically. And so what some states are doing is saying, okay, well, what can we do? How can we tweak this tax credit to potentially see if it can be effective or can incentivize the behaviors that we're looking for? And so you see that in Colorado, that they are making some changes to their childcare contribution credit, maximizing the credit amount, kind of allowing for in-kind contributions, so expanding the different types of expenses that would qualify for the tax credit. In Kansas, I think this is an example of something where tax credit's been around for a long time, and the low tax credit amount is really kind of the thing that's holding it back, right? That the maximum amount an employer can claim is $45,000. That's obviously not gonna do it, and so no one claimed the credit in 2020. They made a slight tweak because it was originally limited to larger corporations, and so they made a slight tweak to expand it to all businesses in the state. No data on whether that's been effective yet. But again, I think states are trying to think about, okay, we have these tax credits on the books. They haven't really been effective. What are some creative ways that we can change them and see what happens? So another option for you all to kind of consider as you move forward. This is I think the last slide here. As I mentioned earlier, right, this childcare subsidy system in Massachusetts, it serves about 53,000 children a month on average. there are 300,000 children in Massachusetts under the age of 6 that have all available parents in the workforce. Now, does that mean that all of those children are part of households that struggle to pay for childcare? No, but when the cost is $21,000 a year on average, I think probably a decent portion of them are, right? And so supporting families and providers on the kind of private side of the system, outside of that subsidy system, is really critical, I think, to keeping Massachusetts a place where people can live and work. And I think employers want to be and can be a part of the solution to try to help some of those families that are currently not being served by the subsidy system. But the options that we have kind of in front of us, while they are numerous, I think they need to be thoughtfully considered, and businesses really need to think about what works for me, what is best for my employees, and how can I go about kind of implementing that. There really is no silver bullet, but different solutions for different employers. And I do think that examples from other states show that with support from policymakers, with support from local government, with support from businesses like yourself, there is absolutely appetite for employer-supported childcare programs and benefits. So that is the end of my presentation. I'm happy to take any questions or comments or thoughts from folks, but hopefully that was helpful, like I said, for you all to kind of continue to have discussions amongst yourself and figure out what direction you all want to go in together and how to best advocate for that.
I think before we go into questions, because I'm going to pause the recording so that the folks that are on the call can feel free to ask anything that they'd like. I'd just like to note that at the chamber, we also have a paper that was done by the U.S. Chamber of Commerce a few years ago that outlines some steps that you may need to take into consideration if you'd like to implement childcare benefits at your business. And also we'll be releasing follow-up calls similar to this one that will take a deeper dive into childcare, a particular childcare benefit. And then I just wanted to leave with this. So I am a working mom myself. Here at the chamber, we do have a cafeteria plan that I took advantage of while my 4-year-old was in full-time family childcare daycare, which means that he was at a daycare at someone's home, which typically is less expensive than a group setting for daycare because they have less overhead and expenses that they have to take. But while I had him there, and then also my older son is 10, and his childcare consisted of, fortunately, going over to the Boys and Girls Club. There's only one located in Mashpee. So he went over there after school. And then also he went to the town's summer camp. And so my childcare setup was nothing super extravagant, but I will say that I've calculated the costs and I was paying about $17,000 a year for that available childcare. So there are many families that have only access to group centers for childcare, especially when you get into the Lower and Outer Cape. And also there are many families where summer camp is not accessible at the town level because it can be extremely competitive to get into those programs. So they have to look at private summer camps, which are more costly. And when you compound all these costs together, it just can get quite extravagant. So I just wanted to leave with some actual, real costs. And we do have some other costs there. I'm happy to speak with any employer that's interested in implementing any childcare benefits to figure out how it can work within their scheme. So with that, I'm going to pause the recording.